Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. All right, Dave, tell me what's going on with your elbow. What happened?
Playing golf, just injured my elbow. Had it like that for about 4 or 5 months, and
Okay.
it's just never gotten better. It just gets a little bit better and then a lot worse. I'm also an arm sleeper, so I sleep with it
No.
up over my head, and I think sometimes, when I wake up, it hurts more than even playing golf with it. So
Okay.
it's been pretty painful.
How much pain from 0 to 10? 10 is emergency room.
I would say about a 6.
Okay, and where do you feel the pain exactly?
Right here in my elbow, right there.
Right there. And what kind of pain? Is it dull, sharp, aching?
It's just an aching pain. It's
Okay.
not sharp. It's not like it stings me. It's a constant pain.
How much constant pain from 0 to 10?
Same thing, about a 5 or a 6. It's an uncomfortableness. I mean, I've
Just a
gotten
nagging
right.
feeling.
Right.
But when you golf or lift stuff, the pain increased?
Yes, that's when I definitely feel it a lot
And-
more. If I pick up something heavy, I definitely feel it. If I move a certain way, I do a lot of driving too, and I'm driving like this.
Oh.
Sometimes after I'm done driving for a while, I bring this back. It's like, oh, I can feel that.
So we need to work on your posture with driving. This is not the best thing. You need to have your arm
Down lower? Okay.
lower. Yeah, and the sleeping posture too. That's not the best posture to sleep.
I
So
know.
we're gonna go over after we finish the video
Okay.
the proper body mechanics to make sure you're not doing anything that make it worse. So have you had any treatment for the last 5
No,
months?
haven't had any treatments.
Okay, so we're gonna do the motion that aggravate your symptoms, and you let me know how much pain from 0 to 10.
Okay.
So we'll start with lifting now, and I know you said swinging. You feel it?
I feel it. About a 4.
In that spot, yeah?
Yep.
Okay, so we're gonna do a swing now.
Okay.
Alright, so let's do 5 swings, and tell me how that feels. How
I
much
can feel
from
it.
0 to 10?
That's where I get the 5 or 6.
5 and 6. Okay, is there any other motion or just a swinging and lifting?
Just the swing is the biggest part.
Okay, so we did 5 and you felt it, so after the treatment we're gonna try it again.
Okay.
Okay. So make sure everything pain-free.
Okay.
Okay, if you feel pressure, that is normal to feel pressure with the treatment, but pain, that might cause more inflammation. We don't want to cause that. Okay.
Okay.
So this is the area you're talking about, yeah? Feel this knot here. So I'm gonna release it. Feel this thick knot. That should not be there. Normal muscle should be like feel nice and smooth like this, and here it feel like a little rock, like just this tissue that stick together. No mobility like this. It feels very hard. So how often do you golf?
About 3 times a week.
Okay. So you will not be able to go back to normal to golfing with this?
I can, like I said, if I just take some ibuprofen or some Aleve, I can get through it, but it's just, I feel it.
Yeah, but you're probably not golfing the best.
Correct.
It's not the best performance. It's probably not very enjoyable when you have
It's
something
not.
nagging like this. And that's the goal of golfing,
Right.
You want to be relaxed and enjoy your time. So I'm gonna go over after we finish the proper way, like mechanic for golfing. And you can see my hand is just rolling over like, kind of like knot here. So if there is no scar tissue, it should feel like nice and smooth, like this area here. Feel how nice and smooth. Feel here, a little bit knotty. Here, more scar tissue here. Feel that grinding? Feel that? That's the scar tissue. So our muscle should act like a rubber band when contract and relax, stretch like this. So when we have a scar tissue, it's like we have a knot in the rubber band. So when the muscle contracts, it does not stretch much. And that's why you feel it when you swing or lifting anything heavy, because you need that full range of motion, so your muscle not fully contracted. So I'm not gonna use a Magna Heel. I use a Magna Heel as a diagnostic and treatment tool for inflammation. So I'm not gonna use that now just to rule out, are you purely stuck in the proliferation stage or you have some inflammation? So let's bend and straighten and how it feels.
Feels better. I still feel some, stuff in here. I don't feel as much in here as much where you were
Okay,
doing
so
what
it's
you
a
were
little bit in
doing.
the back?
More in the back, around
Yes.
the elbow. This area
Okay.
up in here.
Okay, right in here, yeah.
Mm-hmm.
How's that?
Definitely a lot better.
Okay, so let's put your mask on and we'll have you do the lifting and tell me how that feels.
Definitely better.
Mm-hmm.
Still feel it on the elbow.
How much from 0 to 10?
Probably about a 3.
Mm-hmm. Where now?
Like when it's fully extended.
Right in that spot.
Yep, right up in here.
Okay, let's try it again. How's that?
A little bit less.
0 to 10?
Maybe about a 2.
Okay, so you definitely have a little bit inflammation. If it's a mild inflammation with the magna heel, it should take a few minutes. So that's a way to know how severe is your inflammation.
Okay.
Seizures or anything, pacemaker? Okay. Okay, so I use the magna heel as a diagnostic and treatment tool for evaluating the inflammation and also for treating the inflammation. Typically with the mild inflammation, a few minutes of using the magna heel should be fine. For moderate to severe inflammation, patient need to wear the magnet for a few hours. The length of the time using the magnet depends on how severe the inflammation. So if it's too severe, it might take a few days. If it's just a moderate, a few hours. How does it feel?
It's actually feeling really good. I mean,
Yeah,
that's amazing.
yeah, I feel good too. Yeah, some patient when they have really some inflammation, they might feel like kind of pressure decreasing or something like that.
Yeah, I mean, it's literally just taking away just what you said, all the pressure, everything that was built up over in that area.
That's good. Usually recommended you wear it overnight, and the feedback usually say a patient give us a call and say like, oh, it took one night and I woke up in the morning and this one was gone. But they can see the visually the inflammation. But in a lot of cases you cannot see it, but you feel the fullness. Flex extend. How's that?
I mean, 1%, just right there, I feel it.
How much from 0 to 10?
Like 1.
Okay. So where do you feel it?
Same place.
Okay, so I'm gonna put the magnet here and I want you to do the same motion and tell me if you feel any difference with
No.
the magnet here.
I don't feel it with the magnet there.
So that's another way to assess the inflammation, doing the exact same motion with the magnet, and if the pain is gone, that means a little bit inflammation. Some patients wear it, with the ace bandage. And I actually, there's a new model I have that is a belt. Oh, I will show it to you. Okay. So it's coming very, very soon actually. That the magnet and the belt, you put it here. Okay. I don't know. Snap it over here. This is a Magna Heel 2. Okay, bend them straight. How's it feel?
I don't feel it at all.
Okay, so I have this with the belt and it has several belts, even you can use it for low back, for any body part. Let's try it again. You still feel it or it's gone? If it's mild, you should be okay.
It's really mild. I mean, I'm laughing because it's just, I'm not typically a believer in this type of stuff, so
Okay.
I'm really not. But it's, I mean, I can feel it just a little bit, like
0
right
to 10?
1.
Okay, so this is a
Right
mild
there.
inflammation, so we're gonna do this with the new version of Magna Heel, version 2. Okay, do it again. How's that?
Yeah, I mean, I don't feel it.
Okay, let's try this. Oops, sorry. How's that?
I feel it a little bit with this.
How much from 0 to 10?
Maybe a 2.
Okay, but went down, yeah. So that's mean we need to use it a little bit longer, okay? So we'll have you come outside and try the swing.
Okay.
You're doing 5.
Again, feel it.
0 to 10.
Probably maybe a 3.
Mm-hmm.
You know, when I first did it, the first times it was like a 6.
Mm-hmm.
I mean,
So it went down 3 degrees.
at least.
And where do you feel it exactly?
That same place, that elbow.
That elbow. Let me work more on it,
Okay.
and then we'll try it again. Feel a difference between this and
I
the
do.
belt?
I do. This, I don't feel anything at all.
Mm-hmm.
The belt, I still feel a little bit, but
Mm-hmm. Because it's wrapping it around. I'm using 2 now, so that's a stronger
yeah.
than 1. That's what I use usually for the clinic, but with the belt, usually compensate with that using a little bit longer time.
Mm-hmm. Like right now, I don't feel anything at all. I mean, when you use those magnets there, I feel nothing.
Mm-hmm.
Not even superficial, nothing.
Mm-hmm.
When you stop it, I can feel that it's still there, but not
Okay,
with.
because you are a little bit in moderate amount
Mhm.
of the inflammation. So I'm using 2 here, that's double the dosage
Mm-hmm.
of the magnet, and each magnet is penetrate around 2 inches to 2 inches deep. So when I use 2 magnets, we're really going close to 5 inches.
That's amazing.
Yeah. That's why you feel it faster with the 2 magnet, because it's kind of double the dosage. Bend the flex.
I mean, when I first came here, I could. This was really painful, and I could barely feel that now. With this, I can feel it a little bit,
0 to 10.
maybe 2.
Okay. Okay. Let's try with this. Okay. Just make sure it's in the same exact spot. Right here? Yes?
Yep. Mm-hmm.
Okay. Let's try it again. How's that?
You know, I can feel it, but barely.
0 to 10.
Maybe a 1.
Okay, so that's not bad.
Mm-mm.
Let's do the swing.
Okay.
How's that?
That's about the only thing I can feel it on is during the swing.
0 to 10.
3, same thing.
Okay, let's try the magnet here. So you definitely need to wear the magnet a little bit longer, because the amount of inflammation will make sure it's in the right spot. Is that the right spot? Okay, perfect.
That definitely helps it.
Okay. So how much from 0 to 10?
This probably takes it down to about a 1.
Okay, so probably you need to use it a little bit longer. So yeah, what do you think about the ASTR treatment? So you can look in the camera.
I'm a believer. I mean, like I told you, I don't normally believe this kind of stuff, but I wanted to try it for myself. I'm at the point where I wanted to get rid of some pain, and that the way it feels here compared to when I first came in,
Yeah,
astronomical difference.
yeah, that's nice, awesome. Thank you so much.
Thank you.
Thank you. So I went over with Dave over the proper way of golf swing. So we're gonna use this time the proper body mechanics, and I want you to let me know what is the difference before implementing the new body mechanics that I just showed you before the video.
Okay, so get back on my heels,
Yep.
suck in my gut,
Okay.
and swing with my body.
Yep. So
Takes all the pressure off my elbow.
Any pain?
Hardly any.
Okay, so here's the problem we have in this case, and this is very good case actually. A lot of your elbow issue, well, you had inflammation, you had a scar tissue, but because you had incorrect format of golfing, so he was not engaging his core to really get the full swing. You were compensating with swinging your arm.
Just my arms.
So
Right.
basically, instead, this muscle was doing the work of your entire body, which is overworking the muscles, and that causes more stress. It's like your car out of alignment, you're gonna wear the tires that really compensating for this alignment.
Right.
So we need to really do the proper format for golfing or any sports. And that's what I usually like to do with patient. If a problem doing certain sports activity, we have to analyze and see the proper way of doing it. So this way we're not compensating for other body part. So let's do it your own way, and then we're gonna compare it in the camera. Just the bad way, don't do that at home. Okay, how that feel?
I can feel it on my elbow.
Because he's compensating. Okay, let's do the correct way now. You getting the whole body? Okay. And you can see actually his swing is really further. You see his arm? So he has more momentum. He's actually able to exert
Right.
more force because you're using the proper body mechanic. So when you do the correct way, did you feel it?
No, hardly at all.
Okay, so that's mean we have to change the body mechanic, we have to the bad body mechanics, and we have to break the scar tissue, release the fascia, decrease the inflammation. It's the entire system to really make the body works.
Right.
How you feel?
A lot better.
Yeah.
Yeah. A lot better.
Awesome, awesome. Thank you.
Thank you.